That's
You're
my
good.
problem.
You're good.
Is your camera straight?
I'm good. Yeah.
Are you
Just
sure?
pretend like it.
My inner child.
No, everything's
We're not going to recreate.
Everyone good?
so good.
All right. Just for the record, spell your first and last name and your title, please.
Sure. Lindsay Hughes, Lindsay Huse, and I'm the director at Douglas County Health Department.
All right. If you just kind of want to start off by talking a little bit about this tuberculosis case, please.
Absolutely. So earlier this week, we were notified that there was a case of active tuberculosis disease that was in our community. That's not real special necessarily. We did investigate it, however, and discovered that there were quite a few contacts that could have been exposed to this particular case. Over 500 children in the YMCA that we're at here today.
So are you able to say, was it an employee then if they were exposed to so many children, or were you able to say employee, adult, child?
Unfortunately, we're not able to release that information in order to protect the privacy of that patient.
Today, word got, I don't know how long people had. Did you feel like that was enough time to get people here tonight?
We would have liked a little bit more time, but we were also trying to balance the huge lift of getting all of these children's information and getting letters drafted and approved to make sure that everything was correct, making sure our recommendations were correct, balancing that with making sure that we were able to be face-to-face with some of these parents to allow them to ask questions and express their concerns. And unfortunately, that made for a very short timeline. However, we also are wanting parents to know that we have an information line that they can call. Over the next couple of weeks, they can feel free to call us at 444-3400. But it's very important to know that parents of exposed children will have received a letter from the YMCA that either says whether their children were exposed and the date that that exposure happened, or if they were not exposed, in which case they don't need testing or treatment.
Okay, so talk a little bit about that timeline. I know it said from, what was it, this spring or April until now, until a certain date. If you want to talk about that and why such a big gap, or the tuberculosis and being that long.
So it's a little bit different than what people might have seen with other diseases. With tuberculosis, we go back quite a ways from when a person became symptomatic, and that's just to really be very sure that we're casting a wide net and ensuring that we're testing anyone who could have been exposed. Perhaps a person had some symptoms that they didn't recognize were symptoms, or they didn't, it was vague enough that they wouldn't have thought something serious was going on. So we do typically go a full 3 months back from when that onset date that they noticed was, and that was August 21st for this individual, so we go back to May in this case.
How would you characterize the questions, and what did you feel like was the most important answer to give in these questions?
I want to say how impressed I was with our parents that were in this meeting tonight and just the wonderful questions that they brought us. As you can imagine, it could be terrifying to get a letter from your gym saying, hey, your child may have been exposed to tuberculosis. We hear all kinds of stories about tuberculosis, especially in the old days, right? And so that could be really scary, but they came with such wonderful questions. I certainly could feel that there was concern in the room. There was no hostility or anything like that. I think they brought really excellent questions and really seemed to have a desire to obviously work with us to get their children care as quickly as possible.
And so when whoever is infected with tuberculosis, if they're not here, like the YMCA, the school, so is it a safe place then, I'm assuming, if they're not physically here?
Absolutely. So tuberculosis, typically, in order to be exposed, you have to be in a smaller enclosed area for an extended period of time, so over like 30 minutes. If that person is not in that room, then that exposure doesn't happen. Even if that person was in the room earlier and they're no longer there and you come into the room, there's not an exposure risk there. It's really when you've got those respiratory secretions that are kind of flying around that you worry the most about as you're potentially breathing those in. So totally safe if the individual is not here. I can say that the individual involved here is isolating at home and undergoing treatment.
Can you say if they're doing okay or they seem to be?
I believe they are doing just fine. Yeah.
Okay.
Can you talk about some of the symptoms to keep an eye out for, just for those kids and families that are impacted?
Absolutely. So typically with tuberculosis, you're going to see respiratory symptoms. Unfortunately, it's the time of year for all kinds of respiratory bugs, so this isn't the best time of year for something like this to happen. But in addition to a cough, you might see fatigue, a fever that just doesn't go away. They may just not be themselves, not as playful or involved with activities as they normally are. They might wake up really sweaty in the night. So in adults, we call that night sweats. So that you could see that happening as well. And the key here is that those symptoms, it's not like a cold where, you have it for 3 days and it goes away. Symptoms of tuberculosis tend to linger for quite some time and then even progress and get worse as time goes on.
If you want to talk a little bit about the vaccine for tuberculosis, how common is that? Do kids have to get it, or what's that like?
We actually do not vaccinate against tuberculosis in the United States anymore. There was a time when it was in use. It is not. There are other countries that still do utilize that vaccine. It's called the BCG vaccine. Please don't ask me what that stands for. And so certainly we do sometimes see foreign-born individuals who've had that vaccine, but we don't use it here in the United States. The efficacy isn't great, and so it's just not something that we offer here.
Because I taught in California, and we had to have a negative one and test teachers in education.
So what you're probably thinking of is the skin test, which is administered similarly to a vaccine. So what we do with a skin test, this is a PPD, and this is one of 2 tests that we do for tuberculosis. And basically what happens there is you have a tiny bit of fluid that goes just under the skin and makes kind of a little bubble under the skin. And then that's read in 48 to 72 hours. Come back and look at it, and you look to see if you've got a bump under there that has developed. And if there's no bump, then your test is negative.
So is that what people will get when they get tested?
Some children will get that, and others who may have been exposed, yes, would get a PPD. Some. Others will get a blood test. So the other way we test for tuberculosis is through a blood test. That's kind of nice because you draw the blood, you get a result. You don't have to come back to have that read. It's not appropriate to use that test in some people, so really it's kind of an algorithm we go through to determine who gets which test.
Yeah, so I'll start with the case. We were notified on Tuesday of a individual that was attending the YMCA drop-in daycare. We immediately consulted with our medical advisor, knowing that children are at higher risk for severe disease and rapid onset of tuberculosis. Knowing that and having that information, we then started working with our partners at the Nebraska Department of Health and Human Services, our state epidemiologist, and a consultation with the CDC to figure out how best to move forward and what children would really need to be brought in for testing and potential preventative treatment. So in doing so, we started working with the YMCA, which I have to say they've been an excellent partner. They've got great data on attendance records. Just like any case of tuberculosis that we have in Douglas County and public health in general, we do a case investigation and contact tracing, right? Just like COVID. So we asked the YMCA to cross-reference all of their attendance records so that we could make sure that the children that we've identified would have been at the center in the same room and may have had direct contact with the patient. After doing that, we found that we had over 500 children that are going to need to be tested. We quickly partnered with Children's Nebraska to set up a clinic this Saturday and Sunday, and that's going to be for kids that were exposed within the last 10 weeks and are under the age of 4 4 and under that are going to need what we call window prophylaxis, or a preventative treatment that will keep them from developing TB disease while we test them. And in the Douglas County Health Department, we've set up 3 clinics for next week on Wednesday, Thursday, and Friday. Those are going to be for any children that are over the age of 5 or that were exposed more than 10 weeks ago.
Okay, and then that clinic at Children's Nebraska, it's at Children's Nebraska,
That's
right?
correct. Children's is hosting a clinic this weekend. I think they have a capacity to see about 200 children this weekend.
Okay, if you can talk about the length of the illness, how long can you have it, or how long can a person have it?
Yeah, so if you develop tuberculosis disease, it does not go away without treatment. Okay, so it's critical, and it's especially critical with young children, again, who can develop severe disease fairly quickly. It can be severe. It does often progress to meningitis and potentially even death, so it's really critical that we move rapidly. This is an urgent situation. It's not in emergency. We're not suggesting that folks run off to the emergency room, but utilize the clinic that we have set up. If they have questions, they can call the health department at 402-444-3400. That's our information line. Or they can call Children's Hospital. There is a phone number in that letter to schedule those appointments.
As a contagion, I mean, coming off of the horror of COVID-19,
Yeah.
not the same type of contact, and we do have treatment, so whole different world.
Well, we know TB. TB's been around for a long time, and this is not new for public health. We have between 15 and 20 cases of active tuberculosis in the Douglas County area every year. We have nurses who specialize in tuberculosis control. And again, we identify a case, we do an investigation with them, a contact investigation. We identify all their contacts, we test them. We also make sure that the patient stays isolated until they're no longer infectious. In addition to that, we do what we call directly observed therapy, where our nurses actually go into the home every day, and they watch patients take their medication. And it kind of is twofold. One, that we are assuring that the patient's adhering to that regimen, so that we don't have resistance building in tuberculosis, because we only have so many drugs to treat it. And it's also to protect the community, to make sure that we don't have ongoing exposure while that individual is still infectious.
So one big difference, this particular case, as opposed to the ones that you might normally have, was that the point of contact was a group setting.
It was a group setting, and it was children. Yeah, so adults, if this was a situation with a lot of adults, we would probably be handling this a little bit different. We'd have a little more time. Knowing that it's children and that they can progress to very severe disease very quickly, we're taking it very serious, and we're wanting to get them seen, evaluated, chest films, and on preventative treatment if they fall within that 10 weeks, again, and they're under the age of 4.
And then the press release said that an official declaration of a public health emergency is forthcoming.
Yes.
What does it take to get a public health emergency?
So the health director Dr. Lindsay Hughes can issue a declaration for a public health emergency, and that's really to help free up resources, to give us some more leverage, to ask for mutual aid from other health departments if we need staff to come in, let's say nurses to help staff our clinics, things like that. So that's it. I want to make sure that people understand this is not a DHM. We are not ordering anything. This is more of an administrative kind of thing, but it also shows the seriousness of the situation. Often we'll do a declaration of a public health emergency anytime that we may have widespread illness in our community or the potential for.